First of all, Jules, thanks for joining us. This is really, really helpful. Why don't you, first of all, brother, just introduce yourself, let us know who you are and what it is you do for a day job.
Yes, hi Phil. It's really good to be here with everybody from the FIEC. So my name is Julian Wilkes. I am a chartered environmental health practitioner. So I'm sort of part of the Chartered Institute of Environmental Health. I am a health and safety inspector. I'm a lead inspector. Currently work for 2 authorities at the moment. So my job is actually to enforce health and safety law out there in the business sector, in the commercial sector.
Jules, why are risk assessments then, particularly thinking about that with coronavirus and COVID-19 and churches reopening, why are risk assessments so important? Why do churches need to take this seriously?
It's a really good question, Phil, and we sometimes forget about health and safety. You're absolutely spot on. Health and safety law is crucial to how we operate. So within the church, it also applies. So we live under this piece of primary legislation called the Health and Safety at Work, etc. Act 1974. And under there is secondary legislation, one of them being the Management of Health and Safety at Work Regulations 1999. I know it's all words and all sort of titles, but there's some really important key legislation which looks at risk assessment under Regulation 3. And that's all about sort of protecting what we do. It's all about tasks. It's all about protecting not just our staff, our employees who work for the church, but also those other people who are affected by the undertaking of the church. So the congregation, the visitors, anybody who's affected by whatever operation is going on within the church, not just on a Sunday morning as well, Phil, but also those maybe other groups that might be coming to the church, throughout the week. So the user groups, as we call them, we have mums and tots groups. We have a whole range of buildings. Churches are community buildings, so we take a full responsibility for that, and we need to make sure that we protect everybody as far as possible.
So what happens if we don't, Jules? What are the penalties for getting that wrong?
Well, a breach of the health and safety laws and the regulations, as is what the risk assessments need to be carried out under, can impose a fine, imprisonment, and the convictions are not deemed as being well accepted by the church. So yes, the worst case is a fine to the church, and possibly even imprisonment if something very serious could be put on somebody who is a controlling person. So yes.
So thinking about writing a risk assessment to get back into a church building or a rented premises post kind of coronavirus, Jules, if I'm a pastor and I'm looking at this blank document, perhaps a template I've got, where do I even start?
It's a very difficult one. It's a changing beast, Phil. It's changing all the time. Currently, we're working what we call the Health Protection Coronavirus Restrictions Regulations England 2020, and it's also the same for Wales and Scotland. But there's lots of factors to consider. The first step is to make sure that you're working safely with COVID-19. Okay. Now, what there are out there are sort of template risk assessments. There is potentially something that you can get from the FIEC or other professional bodies. But the aim is basically to reduce the modes of transmission of exposure to COVID-19. That's crucial. That's what we're trying to achieve. And that's what we're looking at. And there's 2 types of exposure. Firstly, it's respiratory. So predominantly through droplet form. Okay, so as you well know, if you cough, if you sneeze, if you splutter, even projecting singing, okay, which has come into question, is raising concerns out there in the industry. The second type of exposure is physical and a contact or a direct contact. So this is physically touching somebody. Now, the issue, as you well know, is that within the church, most people who have symptoms should be informed to stay at home to self-isolate. However, out there are what we call asymptomatic carriers, okay? And these are people who are symptomless. These are people who have shown no symptoms at all. So we have to accept and we have to plan that anybody who comes into our church may be a carrier. They may be positive. So physical direct contact, that means you cannot be shaking hands. You cannot be hugging, greeting with a kiss, or even we're going to have to look at how we sort of prevent indirect contact. That's using vehicles. So for example, a knife or a fork or touching something, maybe even like a service sheet we're having to look at. We're also having to expect that anybody can be a carrier. But one of the key things that we need to do within the church is we have to look at calculating capacity as well. So when we start within the church, we need to ensure that the actual guidance is followed, and we're expected that gatherings can be more than 30 people, but it's always dependent on the size of the building, the actual venue space, and that is really crucial. So that's a really important aspect. We need to look at how to calculate the capacity and consider the 2-meter rule, consider that social distancing in order to sort of help come out with a suitable and reasonable number. Another big issue for us, Phyllis, we need to make sure we protect those who are vulnerable. As you're well aware, there's lots of people out there who are deemed as being shielded. There's 2.5 million people receive letters from the NHS. Also, those people are over 70 years of age who need to be, and also those to be suffering from any underlying condition, or maybe still recuperating, recovering, or going through the stage of rehabilitation, even receiving treatment, or anyone where we are aware that they're deemed as being what we call immunocompromised, okay, where their immune system is very, very low. This is particularly the case, people suffering from COPD, you may have heard, or diabetes. So these people we need to really look at before we even get allowed back into the church.
So Jules, let me ask you practically then. So I've got a template in front of me. The templates I've seen, kind of left-hand column, has got a list of risks. What kind of things should I be putting in that left-hand column based on what you've just been saying?
So you're right. So risk assessments are all about assessing the risk. So it's really important to get the risk, the hazard, and the control. And the control is the precautionary and preventative measures that we're looking at here. So good examples. If I give you a few examples here. So the first thing we expect is prior to entering our venues, we want to ensure we have deep cleaning that's taking place. So we need to ensure that chemicals, the place has been effectively sterilized before we even start. Okay, so we need to make arrangements for that. There's some very, very good sort of cleaning companies out there who can actually assist us with that. On arrival, we need to think about sort of segregation. We need to think about separation, and that's crucial. So the first thing that's happening, let's look at the beginning of the service. So what happens? People start arriving in cars, people start arriving on bikes. So we need to think about the arrangements. Where do they park? Where do they put their bikes? Is there ample room for people to kind of get from the car park or the areas of the cycles into the actual church? And then obviously they've got to get access. Now the access point into the church is a really crucial point. It's what we call the pinch point. Entrance into a building is a pinch point. Welcome teams we normally have there, they need to greet obviously from outside. So they need to stay at distance but stay outside. This is a key point to provide good instruction and direction, okay, to our congregational members when they come in. The other thing I should have mentioned is in advance of coming to the service, the leadership and the church leaders need to probably send instruction, clear direction, that these instructions need to be quite closely followed. So access is an important point. Once we get inside, we need to sort of look at increasing our personal hygiene. So this is where we set up tables for hand sanitizers on entrances, using an alcohol spray, wipe or gel to make sure that anybody who comes in, and the children, will be using the alcohol wipes. The children particularly, because they'll run off and they'll disappear into the church. But we need to make sure, mums and dads, that we get our kids to sort of get them to wipe their hands. One thing to work out as well is whether we can implement what we call a one-way system. And this is to ensure that people, when they first enter the building, they can maybe sort of be led and sort of instruct them where they should go to try and prevent any people crossing by. And on the way in, let's try and think about how they can leave the church utilizing other doors, so maybe other fire exits, so they can leave on a different exit, so to prevent that crossover of people on those routes. Again, signage instruction is really crucial, and notices. Floor markings, any kind of directional notices are really, really important to actually have within the church. It also demonstrates that the church leadership have thought about that. When we actually get into the church service, we need to think about the layout, the seating layout, the layout of the room. We've already mentioned a capacity, so we need to look at how we sort of look at these 30 persons or 30 people or 30 families. It might be a case where we look at boxes. I've given this some thought, and it's sometimes worthwhile looking at all your congregation and thinking about the large families. So we need to think about a large family is different to just a single person. So you might want to designate an area for large families, so a bigger box, which may take 7 or 8 people, opposed to a smaller box, which may be 1 person, and think about that 2-meter distance, between them. So just look about how we're going to separate those out. Try and think about the chairs and how about, where we sort of separate people out. Unfortunately, we're going to have to spatially distance ourselves until the time is right when this infection rate has come down. Obviously, a lot of churches, we have these lovely times to chat and to talk at the end. We like food and drink. Unfortunately, I'd advise against that at the moment. So closing cafes, restaurants. I think, even though the guidance from the government, and as you well know from watching the news, from the 5th of July, restaurants and cafes can be open, I think it'd be wise to avoid it for the first 2 weeks, just to see how it's sort of settling in. And then consider maybe how you can open up a cafe. And I can give you some more guidance on opening a cafe or a restaurant in your church at a later stage. We can get that off the FIEC website. But also, what I would suggest is, I understand that some children need food. Encourage the families to bring their own food and drink. Okay, so they only keep it within the family unit, but do not allow or make it very clear that shouldn't go outside of that family unit. So there's just a few ideas as to what to do, and I think that would kind of give us the basics. There's a lot more we can look at, but think about the different steps in the process, from literally when somebody arrives on site to when they leave. What do they do? The toilets need to be very, very carefully managed. They need to be cleaned on a regular basis. We need signage up to say that you need to be washing your hands for a minimum of 30 seconds, with antibacterial soap, using hand air dryers, and hand disposable paper towels, not sort of cloths or towels, because again, these can sort of cross-contaminate if possible.
Jules, it's likely that a lot of churches will designate the responsibility of the risk assessment. Church leaders might designate the responsibility of the risk assessment to deacons or similar. Why should church leaders take this seriously? What should church leaders, do you think, especially be thinking about with regards to this?
Absolutely. I mean, leaders are crucial here, because whatever the leaders stipulate will kind of be then cascaded down to all other members of the church. So leaders have got a really important part to play here. They need to lead by example. They need to be sort of positively out there, sort of explaining from the front to the congregation the importance of making sure we follow the COVID-19 requirements and precautions. It's under your responsibility. Leaders are responsible for their church and their congregation. So it's really crucial that they lead from the front on this one, Phil.
Thanks, Jules. Just tell us a bit about how we ensure that our risk assessment is fit for purpose and not just a box ticking exercise, because I think for some of us that will be a temptation. How do we ensure it's fit for purpose?
It needs to be realistic, it needs to be reliable, it needs to be robust, it needs to be relevant and related to the actual the church. If it's not, if it's somebody else's, it'll stand out. Okay, so it needs to be very, very practical, very pragmatic for the church. There is really good guidance out there, Phil. There is guidance on various links. You've heard of the Health and Safety Executive. On the Health and Safety Executive website, there's a very, very good basic risk assessment template. And all you need to do is, as we mentioned on Phil's last question, to mention some of those kind of categorical areas, and they put those controls down on that. There's also some very good guidance from what we call the OPSS, which is the Office for Product Safety and Standards guidance. And this is something which has been developed, to offer the churches and our places of worship. And that's out there on the net as well. And it's called COVID-19. It's called Guidance for the Safe Use of Places of Worship, and specifically from the 4th of July. And it was published on the 29th of June. Okay, so it's very, very up to date. It's been updated all the time. In environmental health, that's what we use to enforce. So I would recommend you look at that guidance, unless you want to take the guidance, from anybody else who's within the field, but be very careful. Follow the guidance very closely. That guidance we can leave with you, if that's possible, Phil, at the end of the interview, so people can actually look directly on the system and pull that off and read through it.
Jules, are there insurance implications if we got this wrong?
You know what, Phil, there's insured and uninsured costs. Okay, there's reputational, there's financial, and there's possible breaches of health and safety legislative requirements, as we mentioned earlier on. And again, as you're well aware, there are potential convictions if this legislation is not followed. So yes, unfortunately there are. So under the health protection coronavirus restrictions, England Regs 2020, for England, Wales and Scotland, who've got devolved powers but with slightly different guidance, there are chances possibly that if churches don't follow the guidance and we have issues and it comes through to the health and safety enforcing authorities, the officer may decide to serve on the church what we call a fixed penalty notice under Regulation 10 of the regulations, and this can be a fine. Okay, potentially also under another regulation we can actually prohibit the use of the church, so we can close the church down. Okay, if we see that they're not following the guidance. So it's really, really key that our churches do follow the guidance very, very carefully, because there are financial implications. On top of that, there's also civil claims that can be made potentially by individuals. This could be submitted by an individual against a church or against an individual in the church. And again, you know, if they were subtracted the COVID-19, it could pose very problematic. Uninsured costs, as you know, are reputational damage. That can be devastating. You know, as we mentioned earlier on, our churches are community bases. They serve great purpose within the community, you know, for schools, for community halls. So we don't want our churches to be sort of, you know, associated with any kind of outbreak. We're having enough outbreaks in the country at the moment. We're trying to stem them, and we're trying to provide safe places of harbourage, not create more of them.
Final one for me, Jules. Sometimes leaders might be tempted to think, well, if nothing goes wrong, surely I've met my health and safety requirements. Is that true? And if not, what should I be thinking?
Well, I think it's really crucial that it isn't a tick boxing exercise, Phil. It's really crucial that we make it, you know, realistic. What's going to evidence that is action. Okay, so we need to make sure we physically put it in place. So we do need clear leadership. We've touched on that. We need clear direction from the leaders. We need to make sure it's not just a tick box exercise. We need lots of good planning from leadership. So we need to get together and start thinking how we're going to actively run this. And we need to make sure that we sort of follow the guidance. It's really crucial to do that. It is very difficult sometimes to interpret it, and it's very open for interpretation. But you know what? There's a couple of areas you know, which are really crucial. And I'll just touch on those 5 steps, if that's okay. And now, firstly, as we're doing today, is making sure we've got a COVID-19 risk assessment in place. That's crucial. Okay, that's one requirement. Secondly, it's making sure we have developed these new cleaning and hand washing and hygiene practices in place. Secondly, it's making sure that anybody, any staff or any leadership who might be at risk, and if they are at risk, we need to make sure they're working from home where physically possible. So let's make sure they're all out of the way and we're not putting anybody at risk there. That's thirdly. Fourthly, we need to make sure that the setup, we need to maintain this 2-meter social distancing wherever possible. We need to make sure that's implicated out there. And secondly, we need to make sure it is properly managed. Okay, so that's really crucial. But I think once we've got all this in place, you know, it'll work. The infection rate will go down, and we can start making sure that we can bring back our services, what we're all desperately ready and waiting for, as we know. Because, you know, we're social creatures. We like to be with each other. You know, we like to confront each other. So please, let's try and stay with this guidance.
So, Jules, can I be prosecuted then, even if nothing seems to have gone wrong?
So no, you can't be. However, what is really important is it's really important to make sure we are proactive. So yes, if anything had gone wrong, you can be prosecuted if you're proven to be the source of contamination or infection. But likewise, proactively, we need to make sure we put this legislation, these risk assessments in place, because you can be prosecuted even if you don't have them in place. Okay, so it's a legal requirement to have written assessments in place. So it's really crucial to be proactive as well as reactive.
So, Jules, there are 5 steps that churches need to think about before they can move forward and reopen. What are those 5 steps that churches should consider?
Absolutely. It's really, really crucial we stick to those 5 steps. to working safely with COVID-19. These are as follows. Step 1 is make sure you put in place a COVID-19 risk assessment. Step number 2, develop, where possible, your cleaning, hand washing and hygiene practices. Step number 3, make sure that any full-time or part-time staff are mainly working from home if they can. If they can operate from home, absolutely that's where they should work. Okay, that's the third point. Fourth point is making sure our building is set up to maintain the 2-meter socially distance regime to make sure we can work at distance where possible. And last of all, we need to manage any transmissional risk to maintain the 2-meter social distances. So that's all the control measures expected within this sort of risk assessment. Those 5 steps are really crucial. Once those 5 steps are done, you can actually get a nationally recognized COVID-19 working safely secure poster that you could also put up on your church entrance door, which will ensure that anybody who visits your church will know that you've demonstrated and you've signed up to working within this COVID-19 guidance. And that's a nationally recognized guidance that a lot of the inspectors are fully aware of. So have a look at that and pull it off the internet.
Jules, that's excellent. Thanks so much for telling us all about that. That's really going to really help folk to fill in their risk assessments. That's brilliant. Thank you.
Thank you, and stay safe.